Hi, my name is Jen Johnson, and I would like to talk to you about my innovation. It's called the SteriGen. It is a UVC light device which will be utilized to sterilize personal protective equipment in order to keep caregivers safe during this coronavirus pandemic. So, I am a registered nurse and I am also a breast cancer survivor. Like all frontline employees, I am really scared right now to go to work during this pandemic. Especially since my immune system is a little bit more tricky than before I had breast cancer. So I do, like this year already, I've had influenza A twice, and I am very afraid, as are many of my coworkers, to work during this pandemic. A lot of hospitals, in fact, most of them in the United States, are lacking PPE, and many hospital orders have been diverted by FEMA to other areas of the country. So hospitals that were assuming their mask orders were coming in have been um, unfortunately placed in a position where the masks aren't showing up. So staff are being asked to use and reuse equipment which was originally designed to be used once and discarded. The community has been great. They have stepped up. They are sewing masks. They are making donations. However, fabric masks are not always appropriate for direct patient care. The best treatment or the best way to protect yourself is with an N95 mask. N95 masks are named for the amount of particles that they filter out. They filter out 95% of all 3 plus micron particles, and the N stands for non oil, which means they are to be utilized in a non oil working environment. They are the best practice to keep staff safe, and they are able to be sterilized. We don't have enough of them in the United States. 2015 study from the Journal of Occupational and Environmental Hygiene said that a 6-week influenza pandemic in the United States would require 90 million N95 masks. Well, the COVID pandemic has been going on way longer than 6 weeks, and it has no end in sight. So the bottom line is that frontline caregivers do not have enough masks. The good thing is that there's something that we can do about it. As I mentioned earlier, studies have shown that UVC light has been effective in sterilizing personal protective equipment, which includes N95 masks. UVC light is a type of electromagnetic radiation that has more energy than regular light, but less energy than an X-ray. It is classified as UVA, UVB, and UVC. UVC is the strongest, and it works on virus particles by messing up the nucleic acid in the virus. A study from the University of Nebraska has determined that N95 masks keep their fit and filter performance after 10 cycles of UVC light with a sterilization time of 15 minutes per side. So I'd like to introduce to you guys my innovation, which is called the SteriGen. It's a portable, battery-operated light box which contains two 18-watt UVC lights. The lights are it fit inside the box, and they have a 60,000 lamp light hour designation. It's unique because no individual sterilization devices currently exist in the marketplace. This gives the responsibility of self-protection back to the individual. And the marketing for this SteriGen will be to frontline caregivers who are required to wear N95 masks during the COVID-19 pandemic. The features of the SteriGen is the inside front and inside back will house an 18-watt UVC light. This will cut the sterilization time in half, as both sides will be sterilized at once. Whoops. Each SteriGen will come pre-programmed with a 15-minute run cycle. There will be a blinking light in case of cycle interruption. Each box features a battery indicator light for when the batteries need to be replaced. The SteriGen is large enough for one N95 mask to be fully bathed front and back by UVC light, which cuts the cycle time down to 15 minutes because both sides are being done at the same time. The cost of the SteriGen are $45 each. They will be manufactured by an industrial light company in Minneapolis, Minnesota. The price point would be $150 per device. Projected profits for year one would be $52,500 with an estimated initial sales of $500. Year two profits would be $525,000 with an estimated sales of $5,000. Year three would be $10,500,000 with an estimated sales of $50,000 and an assumed 50% decrease in manufacturer cost due to decreased production cost and volume discount. A provisional patent will be applied for, and in order to help us with that process, we will hire a patent attorney for a cost of approximately $2,500, which includes the patent application fees. As this project progresses, we will partner with Mitchell Hamlin School of Law in St. Paul, and we will be hiring law students who will also receive educational credit for their assistance. We will be partnering with their instructors, and hopefully we can provide a symbiotic relationship, or we can develop a symbiotic relationship. They can get credit and knowledge by helping with this project, and we, SteriGen, can also get legal work for decreased cost, essentially free. The funding for SteriGen would come from Women Venture, which is a Minnesota group that supplies low-interest business loans to women entrepreneurs. It is located in the Twin Cities, and you have to be a member of or a resident of one of 15 counties in Minnesota, of which Anoka County, where I live, is included. The initial loan request would be for $25,000 with a 5% interest rate, which would be utilized for legal fees, production costs, and marketing. The bulk of it would go towards production cost. I will be using my house as collateral. The goal is to repay the loan in 1 year by making monthly payments of $2,149 times 12 months. The money for the initial payments will come from my personal savings account until cash flow from the SteriGen sales improve after 3 months. I will continue my current employment, and I will utilize my salary to supplement any extra expenses that may arise. I could also dip into my savings account if need be. SteriGen will be purchased initially by individuals and later by organizations. SteriGen will be shipped out after the first payment is received, and the initial cash flow the first year will come from sales, loans, and savings with bulk from loan. All monies will be redirected into the business. Excess earnings will be placed in a fund used to support healthcare workers for emergency assistance, educational scholarships, etc. SteriGen will seek 503c tax exempt status, as its purpose in existing is not to make money, rather to serve public interests, and the organization's income will not benefit any one individual. Sorry, my reference page, I'm trying to move it. This is my references, but I do have one more important slide to follow. So getting the item into the hands of providers is going to be a three-phased approach. The initial approval will come from Dr. Croston. He is the CEO of North Memorial Health in Minnesota, and also Gail Spoden, who's the Director of Materials, as well as Catherine Grimm, our Director of Infectious Disease. The initial phase would be to market and sell devices to nurses employed at North Memorial as a pilot program. Second phase would be to expand the offering to nurses in the Twin Cities metro area and introduce SteriGen to other healthcare organizations, such as Fairview, Allina, and the Mayo Health System. The third phase would be to partner with various NGO groups who could bring them on mission trips to third world countries. I strongly believe in this product, and although this was just a project for class, I really wish something like this existed in the world. Thank you so much for listening, and thank you for your time.